Hello there, my name is Bob. I work in the simulation suite. Nice of you to drop by. I thought we could do with a quick chat before you come and see me in person. I have lots of visitors. Let me show you around. There are a couple of rooms, lots of computers. That's Alex, Mini-Me, a few cameras and microphones, but don't worry about those, you'll soon forget they're even there. And lots of equipment.
Hey, don't forget me.
Sorry about that. As I was saying, lots of equipment such as oxygen, fluids and drugs, things you're familiar with that you can use to make me better. Look, I even have a monitor that's like the one you have on the ward. When people come to train with me, I tend to become quite unwell, which can make some people nervous. They think they need to do some acting, like George Clooney. But if that was the case, I'd say things like, "I'm Sim Man." Or I may even say, "The name's Man, Shim Man."
Or woman.
Or woman. But that would be silly. If you start to act and do something you wouldn't normally do, it just goes wrong. So be yourself. When you come here, you're going to learn some new things and practice them on me. Use me as a rehearsal for your other patients out there. You'll be working together as a team, just like with your other patients. So remember, you're not alone. I'm here to help. Now sometimes you might have what we call a Dory moment. All that information in your head just slips out of your ears and you can't think what to do next. Some people even forget how to talk. I won't take it personally. I often see dories swimming by.
You know what you gotta do?
I don't want to know what you gotta do.
Just keep swimming, just keep swimming, just keep swimming, swimming, swimming.
If it happens, just do my blood pressure a couple of times and I'll know what's going on. I may ask you to ask me for a cup of tea. This will give you some thinking time and then we can start again. If you do get stuck, there are policies, protocols, guidelines and other people to help you. It's not cheating to get the guideline and bring it across to me while you're working out what to do. Just speak out loud and I will know what's going on. Well, my time is nearly up. I'm looking forward to seeing you next time you come down to see me. In the meantime, why not have a look at what happened to me yesterday?
Good morning, Bob. My name's Kay. I'm one of the healthcare assistants on the ward. How are you feeling today?
I feel awful.
Oh, do you?
I don't know what it is. I feel hot, cold. I feel lightheaded, dizzy. I keep coughing. I don't understand.
Well, what I think we're going to do, Bob, is do a set of observations and then we'll get a better picture on how you're feeling. Is that okay with you?
Yeah, that's fine.
Yeah?
Just make me feel better.
Okay, my love. What I'm going to do, I'm just going to pop this SATS probe on your finger. There we are. Oh, got a bit of a cough as well.
Yeah.
And then what we're going to do is do your blood pressure as well.
I don't think I have blood pressure.
Yeah, everybody has a blood pressure, Bob. Okay? There we go. All right, while that's taken, I'm just going to do your temperature. As you said you felt a little bit hot, so we're just going to check your temperature.
Yeah, I get hot, I get cold.
Thank you. All right, I'm just going to take your respirations, Bob, for 1 full minute, okay?
Okay.
There we go. Thank you. And then lastly, I'm just going to do your pulse, okay? And take it manual so we'll get a better read and see what's going on.
Okay.
Okay, Bob, so I've finished doing your observations and you're scoring a news of 11. So what I'm going to do, I'm just going to ask Tracy, who's the staff nurse, to come and have a look at your observations and have a little chat with you. How does that sound?
Okay, if you could do anything to make me feel better, please.
Of course, Bob, we'll try our best. Okay.
Okay, thanks.
Bob, I've just asked Tracy to come and have a look at your observations. Okay?
Okay.
Hello, Kay.
Hello, Tracy.
This is Bob, yeah?
Absolutely.
Hello, Bob. I'm Tracy. I'm one of the staff nurses on duty today. Kay's just been telling me that she's done your observations and they were slightly out of kilter. So I'm going to ask her to check your blood pressure again and I'm just going to put some oxygen on, okay? And then I'm going to go and speak to the doctor to come and see you. Okay, would you mind checking the blood pressure again?
No
I'll
problem.
Get some oxygen.
Okay, Bob?
I don't really understand. Just make me feel better.
Okay.
Okay, we'll give some high flow oxygen via a non-rebreathe mask and 15 litres. That's blood pressure.
So the
Is
blood
that
pressure's
what, from before?
88/66.
Can I
Yep,
have the obs
there's
chart?
the
I'm
obs
just going to go
chart.
off and speak to the doctor, Kay. Bob, I'll be back in a second,
Okay, thanks.
Hello, Saxon Ward staff nurse speaking.
Hi, it's Kuhn, one of the registrars. Did you believe me?
I did. Hello, Kuhn. My name's Tracy. My situation is I've got a chap here by the name of Bob Smith who's complaining of feeling very unwell. He said he's had a rigor this morning. His obs are all over the place. His background is he had a hip operation 2 days ago following a fall at home. It was a little while before we got to him, so he'd been on the floor for some time. My assessment today is that his respiratory rate is 27, his oxygen levels are 86% on air, his temperature is 38.6, blood pressure of 96 on 86, with a heart rate of 117. According to my assessment, that makes his new score 11.
Okay.
We've given him some oxygen via a non-rebreathe mask at 15 litres. And I wondered if you would come and see him, please. And are you happy with what I've done so far with this decision? I think he has sepsis.
Okay, I agree with that as well. I will come down in a short while.
Okay, is there anything you'd like me to do in the meantime?
We would need some bloods and blood cultures taking,
Okay,
and also some intravenous fluids and intravenous antibiotics as well.
okay, I'll get all the things together and then we'll see you very shortly, yes?
Yes,
Okay, thanks very much.
thanks, Tracy.
See you soon, bye-bye.
Hi Tracy, hi Kay.
Hi.
Hello, hi.
Hello, Doctor. This is the chap I spoke to you on the phone. This is
Yes,
Bob.
yes.
We've done his obs again. His
Okay.
blood pressure has dropped a little bit since I spoke to you on the phone.
Right,
And I just thought you could have a little listen to him.
okay, all right.
Thank
So, understand that Bob had a hip replacement a few days ago.
He had a hip, I'm not
Right.
sure, he had a hip operation
Right,
2
okay.
days ago.
Okay,
Yeah.
fine, okay. Hi Bob, hello there, my name is Kuhn, I'm one of the registrars here. How are you doing?
Hello.
How are you doing in yourself?
I don't feel well, doctor.
Okay, and I understand you have a bit of a cough, is that right?
Yeah, I just can't get it out. I don't understand. I feel hot, I feel cold, I feel dizzy. It's very odd.
Right, okay, and the temperature that we had, just remind me?
Was 38.9.
38.9, okay, all right. Okay, so I think what we should do is first we should get up some oxygen on him, which we've already done, which is good. Secondly, we need some bloods taking, including blood cultures. Thirdly, he'll need intravenous antibiotics,
Yep.
and that's after the blood cultures are taken. We'll give him some intravenous fluids as well, initially a 500 ml bolus of fluids. And we'll also need an arterial blood gas to measure his lactate as well.
Okay.
And also a fluid input-output balance chart, please.
Okay. So, Kay, if you go off and get the blood taking equipment, I will go off and get the IV fluids and the antibiotics.
Okay.
And we'll take it from there.
Okay, Bob, I'll just have a quick listen to your chest, okay?
Okay. Will I be okay, Doc?
All right, Bob, I think you're showing evidence of sepsis, and the sepsis is probably coming from your chest, and you might have picked up an infection, okay? What myself and Tracy are doing is that we are making sure that you have the appropriate treatment, okay, and the investigations as well, okay? So we're going to take some blood tests, including some blood cultures. We're going to give you some intravenous antibiotics and fluids, and we'll do a blood test on your wrist as well called an arterial blood gas. It can be a bit painful, okay, but it's important for us to do it.
I'm sure it won't hurt as much as my hip.
Okay, all right. I'll try not to hurt you, okay?
Bob, is it okay if I just take your cuff off and take your bloods?
Okay, that's fine.
Hello, Bob.
Hello, Doc.
How are you feeling after the antibiotics and the fluids that we've given you?
Ladies and gentlemen, thank you very much. That's the end of your scenario. Well done.